Globally, it's a huge segment of the patient population. It's at an epidemic proportion.
We know right now that far too many are undiagnosed out there.
Obstructive sleep apnea affects more than 18 million people in the U.S. alone, and many of these cases go undiagnosed. SomnoMed not only treats this common disorder in the most effective and comfortable way possible, but they are the one company doing something to raise awareness with dental and sleep professionals.
We're going to improve the health of America.
We've embarked upon a nationwide program to educate dentists.
One of those dentists is Dr. Kent Smith.
Hi, I'm Dr. Kent Smith at 21st Century Dental. I enjoy working with sleep disordered patients. All of our patients are effectively screened for any type of sleep breathing disorder.
This simple process has helped improve his patient care.
It plays a part in every aspect of our practice. Whether we're doing crown and bridge work or whether we're doing any type of restorative, it affects our dentistry in many ways.
But treating more people for OSA isn't just about helping dentists build their practice. Executive Vice President of SomnoMed, John Truitt, encourages dentists to screen for obstructive sleep apnea, in part because he knows general physicians can't always do it.
A dentist sees their patients more often than any other healthcare provider, on average once every 6 months. So the dentist is in an ideal position to be able to identify patients within their practice and then refer those patients on to the sleep physician.
And we have time with patients. We have an hour with a patient usually that the physicians don't have.
SomnoMed helps physicians and dentists better work together.
SomnoMed highly encourages and in fact actively promotes relationships in between dentists and board certified sleep physicians.
I think any dentist should make sure they work hand in hand with sleep physicians.
Once the patients are identified, SomnoMed provides the most comfortable and effective treatment in the field, the SomnoDent MAS oral appliance.
We call it our default appliance. Can you stick your tongue out here for me and say, ah, okay.
The SomnoDent MAS treats snoring and obstructive sleep apnea by advancing the mandible, thus opening up the airway.
I want you to slide your jaw forward for me. Slide it as far as you can. This is what it looks like. It has wings that will hold the mandible forward and holds the tongue forward.
Our device is unique in that it does not lock the upper and lower jaws together.
The SomnoDent MAS is custom made for each individual. It consists of upper and lower dental plates and a unique patented fin coupling mechanism.
In the treatment of obstructive sleep apnea, if one can take the mandible or lower jaw and advance it to the correct position forward, you can mechanically splint the airway open, thereby stopping snoring and, in many instances, effectively treating obstructive sleep apnea.
The appliance is fully adjustable, providing incremental lower jaw advancement to the necessary degree depending on the distance required to alleviate snoring and reduce obstructive sleep apnea.
There are adjustment screws here on each side that we use a little key to move, and each time we move it one turn, it adjusts it forward 0.1 millimeters.
That allows the dentist to control the retention of the device, just like they would with a retainer.
The SomnoDent MAS comes in two different linings, acrylic and the unique SMH B-Flex material.
This is our flagship product. This is the SomnoDent MAS Flex. The Flex refers to a soft liner against the dentition, it's against the teeth. The advantage of this device is it's more comfortable. There are no clasps that are in between the teeth, which means basically the patient's going to hopefully be more compliant with the device. It's easier to wear.
SomnoMed also manufactures the SomnoDent MAS Edentulous for patients with no upper teeth.
Over the last 15 or so years, the products have become more sophisticated, and our product is at the apex of that evolution. It's very easy for the patient to wear, therefore they're compliant.
Perhaps the most important aspect of the SomnoDent MAS is its comfort.
The manufacturers of these appliances have worked tirelessly trying to make these as comfortable as possible. They're so comfortable for patients, and compliance goes up.
Unlike with other devices, the SomnoDent MAS allows the patient to fully open and close their mouth.
No matter how much you open your mouth, your jaw stays in a forward position.
The patient can fully function. They can open and close their mouth. There's more room for the patient's tongue. It's far more comfortable.
If patients have an easy time wearing a retainer, if they said in the past they've either worn a mouth guard to prevent bruxism or they've worn a retainer for orthodontic purposes, they usually find it pretty easy to wear one of these appliances.
Research proves comfort equals compliance, and the SomnoDent MAS is the most comfortable appliance on the market. That means patients are likely to use it long term. In fact, 96% of patients with proven OSA stated they would like to continue to use the SomnoDent MAS, and 91% of patients reported substantial improvement in sleep quality with the SomnoDent MAS.
I think what determines whether an appliance is going to be effective is if the patient wears it or not. And since this is the most comfortable, just from patient reports over the years, it's the one I try to get most patients to wear because I know they're more likely to wear it.
So when they use it, they love it.
Many patients, after one night, say they feel tremendously better. We can get the vast majority of our patients to wear it and wear it long term.
Here is just a sampling of what patients are saying. Christopher writes, "The SomnoDent MAS has changed my life. I haven't slept like this for years. I love that I can chat and drink with the appliance in. I am so happy with the SomnoDent MAS." Joyce says, "Instantly improved my quality of life after years of decline." And Virginia writes, "I dreaded the thought of 2 CPAPs filling our bedroom with equipment, extra tables, and all those hoses. I'm delighted that my SomnoDent MAS is easy to use, easy to clean, and easy to store. I especially enjoy ease of traveling with my device while my husband struggles with his CPAP equipment."
The first report we usually get is, "Oh, I can sleep with my spouse again. I'm not snoring anymore. I'm not making noise." And so that alone is a big boost.
The SomnoDent MAS is less intrusive than the alternative, the CPAP, and it not only alleviates snoring and sleep apnea, it improves the patient's quality of life.
To be able to meet those people and see how they develop over the weeks and months after having the device is greatly rewarding.
The SomnoDent MAS is a patented, clinically proven, compliant OSA treatment.
The AASM has acknowledged that oral appliances have a place with mild to moderate sleep apnea, that they can be very effective and that they can be part of the treatment paradigm in sleep apnea.
Each appliance comes with a warranty against breakage, and SomnoMed uses the highest quality construction.
We provide what we believe is the leading product to treat obstructive sleep apnea.
That's a statement that SomnoMed is confident they can back up. Just ask Dr. Ken Smith.
We love the effect it has on our patients.
Which makes it even easier for him to recommend that you keep a model of the SomnoDent MAS in your office to show your OSA patients as an effective treatment for all levels of severity.
If we don't do it, I'm afraid there's too many patients that will go undiagnosed. We know right now that far too many are undiagnosed out there.
For more information, please visit our website, www.somnomed.com.